Hello, my name is Sarah Robinson. My student ID number is 2495663, and this video is for IMED 5804, Clinical Teaching and Supervision, for assignment number 2, Effective Teaching and Learning in the Clinical Setting, as part of the postgraduate course Health Professions Education. So to begin with, I'd just like to introduce Sarah, she's a student nurse.
Hi, nice to meet you.
In our video today. Our session takes place in a simulation room, and our focus will be on basic airway management. So, hello Sarah, thank you for attending the session today.
No worries.
So just a quick overview of what we're going to learn today. So we're going to go over just some airway anatomy, and then we'll go through some common airway obstructions. We're going to practice some and provide adequate jaw support. Then we'll go for some selecting and inserting basic airway adjuncts such as oropharyngeals and nasopharyngeals, and then we'll go on to effective bag mask ventilation. Wonderful. So can you tell me a little bit about your past experiences with airway management?
I've not had any experience with airway management yet.
Yep, wonderful. Is there anything in particular that you're nervous about, or anything you want to focus on, or just have a general overview?
General overview would be good, yes.
Wonderful, no problems. Alright, so let's just begin with identifying the anatomy of the upper airway. So as you can see here, up the top here, we've got the nasopharynx, so up here. Then at the back here, we've got the oropharynx. In front of that is the tongue. And then as you further go down, you can see the where the vocal cords would be, and you go into your larynx and your pharynx. So I'll leave that one there as a point of reference for us. Wonderful. So what do you think some things could be for some common airway obstructions? What's in the mouth that could cause them? Tongue, excellent. That's the most common one. What else can you have in your mouth that might cause an airway obstruction?
Oh, piercings.
Piercings, What are these things?
Teeth.
Teeth, so dentures in particular.
Braces.
Braces, it could be food. Kids like to put toys in their mouth, and surprisingly batteries are allowed for kids. No problems. So to stop the airway obstruction, so in particular the tongue, we'll do some jaw support. So have you ever done jaw support on anybody before?
I haven't.
No? Practiced on a mannequin before?
Yeah, a long time ago.
No problems. Alright, we'll just go through the start then. So I'm just going to push you over a little bit if that's okay. So we're going to start with our 2 fingers here, and we're going to go for the angle of the mandible. So you'll be able to feel it on yourself, which is this one here. Wonderful. And what we're going to do is that we're going to lift the jaw forwards, and what we want to aim to do is get the bottom teeth in front of the top teeth like this. So do it. Beautiful. That's what we're aiming for. Okay. So we can tilt the head back a little bit if we need to. Try to put your hands on their cheekbones, not on their eyes and stuff. We don't want to cause damage, and we can just go like that. We have these thumbs free, so if we're helping with the airway at all, we can open the jaw, or we can hold a face mask on the top. So I'll just get you to give that a go if that's okay. So the 2 fingers, angle of the jaw. You're aiming for here. Wonderful. Oh no, thumbs go there.
Thumbs.
Wonderful. Excellent. And then push that jaw forward. It's a bit tricky, isn't it? But no, good job. Nice work. Excellent. So we'll move on to airway adjuncts next. So the most 2 common ones that we use are the oropharyngeal and the nasopharyngeal. So we'll start with oropharyngeals first. I've got a big selection here. So this is the oropharyngeal, also called an OPA, or the old school name is a Goodell. We find a lot of the old school doctors will say, grab me a Goodell. You can, I'll get you to hold one as well. You can feel that it's nice and hard. It is curved. There is a little tapered bit at the bottom there, just to help with assertion on the back of the palate. There's a bit of a reinforced bite block in the middle, so if a patient wakes up or is having a seizure or something and they bite down, you're going to still have your airway because it's nice and hard. There's a flange at the top to stop from over insertion. You can see that it's hollow, so if you wanted to stick a wire suction catheter down there and suck out some secretions and stuff, we can. They're color coded to make it easier, and you can see that it comes from very, very tiny to quite big. Okay. Do you know how to measure for an oropharyngeal?
I think it goes from here to here, I
Yeah.
believe.
So from your corner of your lip, and then we go. Oh, I've got a picture. Sorry. So we go from the corner of the lips, we go across the cheek, and then we go to the angle of the mandible. So we go from here to the hard part of your mandible. So I'll leave that one there. So I'll grab this one, so you can see that we go from the corner of the lips, or from the teeth, so hard, and then we go across the jaw to there. So you can see this one's too big. So we'll just try the next size down. We'll go for this one. So we go from the corner of the jaw there, across the top, and you can see that that one goes right to the angle of the jaw, and that one's much better for you. No worries. Do you know how to insert one at all?
No.
No? Wonderful. Well, not wonderful, but that's okay. The easiest way to do it, you stick it in upside down. So you can do a little bit of jaw support or head tilt to help. We open the mouth, we stick it in there, so this bit will push the tongue down as we go in. And then we go into, we feel the back of the palate. We don't want to push it because we don't want to damage the palate. But once we get to there, we turn it. So as we turn that, we can see that we're pushing the tongue out the way, and then you keep going and you insert it till you get to the top of the lips. And then with that, you can do some jaw support to help open the airway as well. Okay. Ready? You want to give it a go?
Sure.
Yeah. Are you happy there, or you want to go for the side? I think it's
I'll probably go this side.
Yeah.
So then I'm going in this way.
Yep, so pop around the other way.
Yeah.
Wonderful.
And then when
feel the back of the palate. Push the tongue down.
And then
and twist.
Yeah.
Wonderful. And stick it in, stick it in, stick it in. Beautiful.
Yeah.
Wonderful.
Yeah,
How easy was that?
Yeah, it's actually
Yeah. Do you want to do it again,
Yes,
or are you
please.
happy
No,
with
I
that?
can do it
Let's
again.
pull it out. Excellent. So pop it in upside down.
Just making sure it's the right way.
Yeah.
Yes.
Wonderful. Push the
Push
tongue
in.
out the way. Excellent. Much more confident this time. Good job. And twist it.
Oh no.
No, you're right.
Okay. Yeah.
Wonderful.
That way, but I've got
Good
it.
job.
Yeah.
Nice work. All right. Let's move on to the nasopharyngeals. So the main difference between the nasopharyngeal and the oropharyngeal, one goes in the mouth, one goes in the nose, but essentially they do the same thing. But you can see also, this one's a bit softer, just because your nasal palate is much softer than the palate of your mouth, so it's more of a bendy tube. Also has a beveled edge on the end, which makes it much easier for insertion. Has the flange on the top as well. And this one's, what's the word? It doesn't have any colour labels or anything like that, but they have sizes written on the side. Okay. So do you know how to measure for a nasopharyngeal?
Isn't it from the nose
Excellent.
to the ear?
Perfect. Excellent. Wonderful. So that's probably a good size. What size is that one? Yes, I think a 7 would be good for him. I'll just show you how to insert and then I'll let you have it. Okay. So again, do a little bit of the head tilt. Pull the nose back. We always try to go for the bigger of the noses. Generally, the right side is bigger than the left, but everybody's different. But we always have a look first, so we pull it back a little bit. We put some lubricant on the tube, and essentially we just pop it in following the natural curvatures of the airway. If you get some resistance, don't force it down because we don't want to cause damage to the airway and get blood in your airway. You can give it a little bit of a turn. It quite often gets caught on the back of the tongue, which is fine because what you're doing is forcing that tongue forward out of the way to open the airway. So you can give it a little bit of a twist, that's fine, and then it just goes all the way in until you get to the flange there. Wonderful. So I'll take it out and I'll get you to give it a go.
So I'm going to put my nose.
I also have a picture here as well. Oh, sorry, I missed that. Can we do it again?
Yeah, sure. So I'm pulling the nostril up.
Wonderful. Excellent.
And I'm going to follow the path down. No resistance, so I'm good.
Wonderful. So the only thing to be mindful of the nasopharyngeals is that you shouldn't put it in anybody that's got a base of skull fracture. Anyone that's got a nose fracture already has blood and stuff in their nose airway because they don't want to cause more trauma and more damage. Alrighties. And then we'll go on to, you can also see that they also come from very, very big to very, very tiny. So that's for a neonate and that's for a large adult. And then we'll move on to bag mask ventilation. Alright, have you ever done bag mask ventilation before, even in the simulation room and stuff?
I don't think we have.
Not really?
No, not much of it. No.
Alright, so you know what a bag mask valve is? Yep. So the key components is that we have a self-inflating bag there. It's also got this little valve, a one-way valve, so things can go in, but they can't come back out. We've got a nice padded soft mask there. We've got a reservoir volume bag, and then this gets plugged into 15 litres of oxygen. Because if you're giving this, you're using it as a life-saving measure, and we want to get as much oxygen in as we can. Okay, so the best way to pop the mask on is to go from the bottom of the chin there, and then just pop it over the nose. You don't want it to be too far up, otherwise you're not going to get a seal on the mouth, and you also don't want to be blowing anything into the eyes and stuff. You also don't want it too low, because then you're not going to capsulate and get a nice seal over the nose and stuff. So I always just go to this part of your chin here, in the base of the mask, and then just go over the thing there. Now you also can do a little bit of jaw lift and chin lift and stuff. You can use your 2 fingers. That's why it's nice to have your thumbs free and stuff. So you can either do it 2 hands, where you have it like that, and then somebody else ventilates for you, or you can do a one-handed ventilation, and you'll go like that. So do you know what the average respirate rate for an adult is?
I do, but it's gone.
12 to 20. So if we aim for a respirate of about 12, that's fine. So generally what we say if we're doing a resus or whatever, when you take a breath, give a breath type of thing. Wonderful. So I'll get you to have a go at trying putting the mask on and stuff.
Okay, so I want to go over a good seal, so down the bottom.
Over the top of the nose. Wonderful. Do your little jaw support with your things there. Wonderful. So if you got a smaller man, it's quite easy. You and me both have small hands. I really struggle with people that are bigger and stuff. So if you can't do one-hand ventilation, it's fine. Just get someone to help you. So I'll get you to try the 2-hand. So pop your fingers under there. Thumbs on the top there. Do big jaw support. Wonderful. And then wonderful. You can also feel if there's any leak, you'll be able to feel it on your hands and stuff.
And what about if my patient had chronic obstructive pulmonary disease?
You'll just do little breaths. Still do your maximum oxygen and stuff, and just ventilate and get your sats as best you can.
Okay.
That was a very good question. Thank you. So just be careful with your pour technique. If we don't open the airway effectively, essentially it goes all into your belly, which is not what you want. You want it to go into the lungs, and if you get too much air in the belly, you can also cause aspiration and stuff. So, which we don't want. Alright, so that concludes the end of our session. Thank you very much. So we've gone through the airway anatomy. We've also identified some common airway obstructions. We've practiced jaw support and provided adequate jaw support. We've gone through selecting and measuring for and inserting nasopharyngeals and oropharyngeals, and we've gone through bag mask ventilation. So well done. Thank you, Sarah. That's okay. So just as a follow-up to that session, what do you think went well in the session?
I liked how you went through all the different equipment and how to use it, and talked it through in an easy way to understand.
Oh, wonderful. Thank you. So with your skills that you perform, so doing the oropharyngeal, the nasopharyngeal, the jaw support, and the bag mask ventilation, what do you feel like you did best?
Probably this, the bag.
I thought you did your jaw support.
Oh, okay.
Great. No, nice, easy, good technique. Wonderful. And if you were going to do something different next time with anything of your techniques, what would you do different from what you knew previously?
Obviously measuring. My measuring is obviously quite important. And just not forcing the equipment in for resistance. So I think that's something.
I just want you to have more confidence. We can practice this as much as you want. I also have an extra learning resource here for you. It's on airway anatomy and airway devices. This is what I give all to the anaesthetic nurses and stuff. Lots of the stuff that we've gone through previously, the basic stuff with the Goodell's and stuff, and then we go on to more difficult stuff with the intubation equipment and stuff. But I want you to have lots and lots of confidence. And if you're ever in a situation where you get the opportunity to learn something, I want you to do it.
Yeah, will do.
Wonderful.
No worries.
Thank you so much.
Thank you, Sarah.
Thank you for your time. Thank you for watching. Thank you.